Hey, everybody. Welcome back into another edition of the Dental Assistant Nation podcast powered by drbicuspid.com. So glad that you've joined us for another episode in our series where we are talking about dental unit waterline safety, working with the good folks at Stericyl to educate you and to help you keep yourselves and your patients safe. And I'm glad to have on a dear friend and returning guest. Woohoo! Tia Hunter, with all those acronyms behind your name. How are you, my friend?
I'm good. Doing very well, thank you. And you?
I'm doing wonderful because I get to talk to you for just a few minutes.
Listen to
you. I love how you champion the dental assistant. I know you are a dental assistant, so you champion them, which is fantastic. Love that.
There's just not enough education out there for us. There's just not enough champions. You're a champion for us, too, and I appreciate that because you were never one. So you didn't have to pick us up. You just did.
I just love what dental assistants do, and I love being able to talk to you and all your brothers and sisters who are out there. But I want to pick into that brain of yours right now.
Okay.
Because
it's kind of mushy up there, but go ahead.
That's all right. I still like it nonetheless. I think so often that dental assistants wonder if they've actually got the opportunity to choose how to make sure their patients stay safe. If they have the opportunity to choose how to make sure their water lines are safe. Do they have that? Is that a myth we need to bust, or is that something they need to work with their doctor? What's your opinion on this?
They have every opportunity and option available to them. It's just lack of training.
Okay.
You don't know what you don't know. But dental assistants, you know that we make up the largest percentages of oral healthcare workers. We could take over the world.
You could.
There are something like 380,000 of us now. It's crazy.
It is.
So we absolutely have the opportunities to make sure our patients stay safe if we're following the proper protocols. Now, we need to be educated and we need to know what to do in order to, what do we do? How do we keep our patients safe? What is a waterline protocol, for instance, and how do we follow that? And that's, why one of the, main reasons Sometics is amazing, because they provide you with a protocol and the products to use to make that happen.
So we have so many new dental assistants coming in.
Yes, we do.
And so often it is the, shall we say, senior dental assistant or somebody who's been there a little bit longer who trains that dental assistant.
Yeah.
Do we have enough training focus in the office on the right way to do what we're talking about today?
And that's a great question. And, there's nothing wrong with being trained on the job.
Yeah,
absolutely not. And we're in such a need that we get people in and, train them to do certain things. But, man, we're busy.
Yeah.
We can't train everything all in one day. You're not even going to know 6 months, I say. Really?
Yeah.
Before you know it all. And so a lot of times it's, someone who's been there a while. And no offense, but if they didn't know the proper way to do it, they're teaching it wrong too, right? Like there's so much, and Kevin, this, so much misinformation out there about how to do this, how to do that, what's the proper way.
Yeah.
I go on to social media and somebody will say, hey, how do you do this? And you'll have 50 different answers come up,
And 49 of them are scary.
Exactly.
They are.
Exactly. And so, it's all about making sure we're doing it the right way. Yeah. And there's all kinds of ways we can find that out, but you gotta look for it. You gotta put in some effort if you want to do it. And I tell dental assistants, you're an oral healthcare professional now, right?
Boom.
And so it's your job to make sure that you're doing this. So find out. There's lots of resources out there available to you.
Well, talk to me. Where do they go? Where besides Facebook?
Right.
I mean, seriously.
Don't go to Facebook to get any of your or social media, period, to get any of your information, because, there are many of us trying to share great information, but the misinformation is, deafening. There's some great websites you can go to. There are articles. Dr. Bicuspid has great articles in there. Sometics on their website, they have all kinds of information on their website. Visit it, You hear about these products, you want to know about it, go to their website, learn about them, read about the IFUs, pay attention to what they're saying, and that's where you want to get your information, not from somebody's uncle who got it from an aunt who got it from a cousin, and then their dog. We don't want to do that.
No, when dogs are trying to give you Waterline information,
right.
just do not listen.
It's not any good.
You mentioned Solmedics, and we know Stericyl is such a big part of dental unit Waterline safety. Talk to me about their products and how you really think that they can help make dental assistants those infection control rock stars that they need to be.
Well, where do I start? Because first of all, they have an amazing product, the fastest Waterline testing on the market today, and it's Fast Check, and it's 15 minutes. It's super easy. One of the things is we're busy. There's 18 tabs open in our head at all times, and we're trying to do, the schedule is a revolving door, and this patient canceled, and we put this one in, and we're moving this one over from hygiene, and we're running around like that. We need things that are going to be laid out, fast, easy, done, right? Yep. So Fast Check is a Waterline testing that's amazing. It's only 15 minutes. You don't have to stand there and watch it. It's super easy to read. I love it. And then you have the, 500 colony forming units per milliliter of bacteria is safe for consumption. So 500. Well, what is yours? Okay, Fast Check doesn't tell you. That's a pass-fail. So then we have, the R2A, which is which is the water that we're going to collect. We're going to send that off, and that's going to give us back a number.
Yep.
So that we do quarterly. And then shocking quarterly as well. We're going to shock our system. Now, I tell people bacteria in Waterlines is a lot like bacteria in our mouth. You don't brush your teeth for 2 or 3 days, you get a little bit of buildup. You don't brush your teeth for 2 or 3 weeks, you get more buildup. That's what happens in our Waterlines constantly. The bacteria is, it's growing. It's an organism that lives. It's feeding off each other. It's colonizing. And so we brush it out of our mouth, but we don't do that to our Waterlines every day.
Right.
So it's important that we are treating it. And we treat it with the Stericyl straw. Mm-hmm. That's a 365 straw. We shock it. Easy, fast, perfect for a dental assistant. So those 4 products together, Fast Check, the R2A testing, the Citracil, and the Stericyl straw, those 4 products together they're lean, they're fast, they're easy, and that's what we need to have the time to maintain our Waterlines properly.
And I want to go back to a word you just said there, easy.
Easy.
Because honestly, I know that one thing that I have heard is how important it is that these products all work together.
Yes.
And you're not piecemealing things from different spots.
No. It's got to be easy. Again, we're too busy. We've got things going on. If we can't do it quick and easy, then we're not going to do it. I know that. I see that. I was one of them, Remember, Kevin, when I started in dentistry, we didn't have any infection control. There was none. We just flew by the seat of our pants. We didn't wear gloves. We didn't autoclave anything. So it's watching this whole thing evolve through the years. Yeah. If it's not fast, it's not easy, we're not doing it. We don't have time for that. And that's what I hear all the time. And I think one of the things that Solmedics does with their products is they make it fast and easy so that we have time to do it and do it properly.
Absolutely. And I think one thing that I heard the other day about the current hiring shortage that we're in and how so many dental assistants are running around trying to make sure that everything is done. A lot of practices are shorthanded. Mm-hmm. It's that whole work smarter, not harder thing.
Yes.
And it feels like that's what we're talking about here.
Exactly. That's exactly what we're talking about. And how many times, if I had a nickel for every time I heard, well, that was Mary's job, and Mary's gone.
Yeah.
Patty's gone.
Oh, Patty.
Patty.
I love Patty.
I got to talk about Patty. Patty's no longer with the practice. Well, how do you test your Waterlines? Well, Patty always did that. Well, where is Patty? Well, she got retired about a year ago, and you're like, nobody has taken it over as a champion of the office to do that. So, it's important that our dental assistants are stepping up. Yeah. It's important that we are, helping each other, and it's important that we're doing it, period.
How have, you've been in this for, I'm just going to say more than a year. We're going to leave it at that, okay?
43.
Okay.
Almost 44,
I wasn't going to say that, but okay.
I know. I'm only 45 though, so.
But you've seen the rise of the infection control coordinator actually happen.
Yeah.
And I think
there was no such thing. But
how great is an opportunity is that for dental assistants that that's available and that they can embrace that with the right knowledge and the right tools as well?
And I just wrote an article about this not too long ago.
Oh, wink, wink.
You're right. Infection control coordinator wasn't even a thing back when I became a dental assistant. Every dentist had one assistant, and that was it. And now, my gosh, a dentist needs, multiple assistants just to make sure everything gets done. But that infection control coordinator is a huge responsibility. It's the most important job in the practice.
Oh.
If you're getting patients in the door and you're collecting money, what good is that if we're making them sick and back? If we're not, doing what we need to do, proper infection control, and we're making people sick in the back. And that's really what happened. It doesn't matter how good your front office runs. If your back office isn't run properly, then you're not really successful, are you?
Well, and if you're making people sick, you're not going to be in business very long.
And that's another thing. That's a great point you bring up. The fines, since COVID, we've noticed that OSHA is more on the prowl.
Yeah.
We've seen things. We know patients are more aware, Kevin. We know that patients are more aware. Team members have become more aware, and we see whistleblower team members call in, and the fines you're going to suffer by not doing it properly far outweigh it's going to cost you doing it properly.
Absolutely.
So, why not do it right the first time?
I know you believe, and I do too, that every dental assistant can be a rock star in the practice.
Oh, everyone.
I know you believe that. But I think that handling infection control and dental unit waterline safety in the right way is such a big step toward doing that, but it's so overlooked so often.
It is. And, I tell every practice you need to have an OSHA coordinator, you need to have a HIPAA coordinator, and you need to have an infection control coordinator. They have to be separate. They can't be one person. That person will be in the corner, in the fetal position, sucking their thumb. We've got to delegate this out, to different people. And it's so important to identify those roles and to make sure we have the proper people to take them on. And there are, you want to get ahead in your career and you want to grow, that's a great way to do it.
Absolutely. All right, so big picture here. How does the Stericyl Safe Water Solution, how does that help the practice stay safer and really elevate those dental assistants out there?
Well, the protocol for the safe water is that. It's the protocol that every office needs to do to make sure they're doing things properly. That infection control coordinator or someone who wants to step up and champion of that is the one that's responsible for that. But that alone, their products alone, using them in tandem like we're supposed to, when we're supposed to, is the best tool available for dental assistants to, or dental hygienists, not just, assistants, but that infection control coordinator to make sure they're doing everything properly.
All right, so one more question for you.
Sure.
If you were able to transport yourself into every dental practice, whenever it came to dental unit waterline safety, what would be your magic wish or your little thing that you'd wave the wand to make sure that it actually happened?
It would be to educate them, provide them with the protocol and educate them and let them know that, that this is really an easy thing to do. When we don't know what we don't know, we don't want to do it because we don't know how to do it. And the harder it is to do it, we kind of push away from it. Like taxes. Oh. Nobody likes to do their taxes, right? So we're like, don't want to do it. And, about April 14th, we're like, we got to get our taxes done. Or maybe that's just me. But so we don't want to do that. It's the things we don't like to do, we push off.
Right.
When it's made fast and it's made easy and it's almost, like fun to see the test results.
Yeah.
You want to do it. You want to be a part of it and you want to do it. So so I think that that's really what I would do. The other thing I would do, if you're going to ask me what I would do second.
Yeah, I will.
I would go into every dental office and I would raise their chair up, all the way up as high as it go, and then I would look under it because they're dirty, Kevin. Underneath the chairs are dirty. So that'll be, that's a whole podcast all in itself. I have pictures.
See, just the thought of that makes me sweaty. It really does. So, Tia Hunter, thank you so much for being on today.
Hey,
I really do appreciate it.
Thank you for having me.
No, you're always, and I just want to say this, you're always sweet to come on this podcast. And I love that you have shared knowledge about not only dental unit water lines, but just how to be that rock star dental assistant so many times. And
because
thank you.
They all are rock stars.
Absolutely.
We just got to help them get there.
All right. Well, thank you for that.
Thank you.
And thanks to all of you who've listened to this episode of the Dental Assistant Nation podcast or watched it. Really do appreciate that in conjunction with drbycuspid.com. Hey, this is part of a 4-part series that we are doing with Stericyl to educate you on infection control and dental unit waterline safety. So make sure you're checking out all 4 episodes. And until next time, it's Kevin Henry, Editor-in-Chief for Dr. Bicuspid and the host of the Dental Assistant Nation podcast, signing off. And as always, wishing you nothing but success ahead.